If you've been driving on the M2 East in Johannesburg, you'd have seen a billboard that claims there's been a 42% drop in occupational diseases in the mining sector. But NGO Africa Check has questioned this claim. Let's find out why. Kate Wilkinson, senior researcher at Africa Check, is with us in studio this morning. Good morning to you, Kate. Thanks for coming in. Many out there are probably wondering, first of all, what occupational illnesses are. Can you just give us some examples of those?
Yes. Occupational illnesses or diseases can span a whole range of illnesses in many different sectors. But with regards to this claim, it focused specifically on those in the mining sector. So, for example, you're looking at diseases such as silicosis, pulmonary tuberculosis, and diseases which are associated with people who are exposed to the hazards and risks of mining on a day-to-day basis.
So let's focus on this billboard that's caused a little bit of controversy. It claims there's been a 42% reduction in these diseases. Over what period are we looking at?
Well, that's the question we wanted to find out as well. When we approach these claims, the first thing we do is we go to the person or the institution or department who has made the claims and we ask for clarity. And one of the first things you should ask when you see a claim of a percentage reduction or increase is what 2 years are being compared. And when we approached the department and we were told that the year 2009 was being compared to the current period, when we asked for clarification on what the current period actually referred to, whether it be 2012 or 2013, we didn't get any response. And without a response or clarification, we then had to look at the data and see whether we could verify this claim or whether it was unsubstantiated.
Were you able to verify it?
What we did was we looked at what the department had told us. The first thing it said was the first year being compared is 2009. Without then clarification, we had to look at the latest available data, and that is from 2012. And when we compared those 2 years, the reduction which we calculated was actually a 25% reduction, not 42% as was claimed. We presented these findings to the Department of Mineral Resources and we asked for their comment. We did not receive a response and we are yet to hear from them.
Why would it be in government's interest to fudge the figures?
It can be an interest for a number of reasons. Every department, over the past year, wants to have their good story to tell, especially considering the state of the South African mining sector with what is now stated to be the longest recorded strike, problems and legal battles regarding occupational diseases such as silicosis. It is in their interest to try and present a good story that shows a reduction in these terrible diseases. But if you're not willing to disclose the years you're comparing or be transparent, then you're really going to be taken to task on it.
Kate, this is a system in which mines monitor their workers who are exposed to hazardous substances. They then report that to a safety inspectorate, which is supposed to keep track of these numbers. How accurate or transparent a system is it when the mining companies have to come up with those figures themselves, bearing in mind there's litigation against them by people who feel they've been affected by working in those mines?
Definitely, that is an issue which has been raised, and with regards to these reported numbers, that is something you have to take into account. But from our perspective, when it comes to looking at the claim and the figures, we have to go based on the available data and what is publicly available, and that is the data we get from the Mining Health and Safety Inspectorate.
That surely suggests the system is slightly, well, questionable, isn't it? If government is not itself going in and monitoring from time to time, perhaps through inspections or the like, exactly what those numbers are looking like.
Yes, a system which relies on self-reporting will always be open to abuses, and really it is up to the department to ensure that the numbers which they're getting are accurate and to hold the mines accountable for the illnesses and diseases which occur in their shafts.
From a more human point of view, we know that these class action cases have been going on for a while in a number of countries all over the world. What does it mean when figures like this are in dispute and they're going before the courts?
I think that it first of all calls into question the integrity of a department which is willing to state figures but not willing to back them up or engage with members of the public or organizations like Africa Check when we ask them about them. A lot of litigation across many different issue areas is based on government information and data which is collated and released by government, and it's important that that information is seen to be sound and that the departments are willing to actually engage with discussion about the validity of the data and whether it is reliable.
Kate, well, from Africa Check, thank you very much for your time today.